Howard and Lynne Halpern have worked hard to get where they are. As they sit high above Buckhead, it might be easy to think their lives are perfect. But in 2006, Howard and Lynne confronted one of their biggest challenges ever.
You know, when they say your life changes on a dime, I can testify to that.
Howard was diagnosed with head and neck cancer.
I think what went through my mind was, today is the first day of the rest of my life.
I have a philosophy of I'm allowed 15 minutes of being angry, 15 minutes of pity, and from the moment that I was diagnosed with cancer, the only thing that came to my mind and my wife's mind is, okay, now what do we do about it?
Deciding where to go for treatment was a difficult decision. Howard and Lynne visited other centers, but after meeting Dr. Fadlo Khuri, they decided to come to Winship.
When you're fighting cancer, you need the courage of your own convictions, and it was ultimately my decision where I was going to have treatment, and treatment to me came to Winship and Dr. Khuri specifically.
Every step of the way, Fadlo was there. Fadlo had me at hello. He had me at hello. I didn't feel like a patient or a patient's wife. I felt like his sister.
I think Howard's courage is an unconventional courage. He's a very courageous man. I think it takes real courage, unconventional courage, to trust someone.
Not only was he knowledgeable, not only was he highly capable, but he emits a very special and deep concern for his patients. I felt it, my wife felt it, and it was a comfort level for me. I knew that he was going to be in my corner.
The treatment was long, the side effects were severe. But the Halperns knew they weren't on the journey alone.
The best way to confront cancer is to have courage. My courage comes from my belief in God and my prayer that He give me the courage, and that the support of my wife and my family and my friends.
That group of friends dubbed themselves the Go Team, and today they're celebrating the fact that Howard is healthy. But he and Lynne realized the success of his treatment was the result of research that was largely made possible through community support.
The type of cancer that I had, the fatality rate 20 years ago was probably 85%, and now the cure rate is closer to that. So we thank God for that. And that happens as a result of philanthropy and support of the community.
Howard and Lynne have made it their mission to provide that kind of support.
I think there are not enough cheerleaders for what we have here. We certainly have become cheerleaders. We certainly know what Winship has to offer.
I think it's vital. It's the lifeblood of the institution. The institution requires and needs support of the community, and the community has to have a facility like Winship.
So having people of this stature being all in their support for Winship and for Emory is just priceless.
Priceless is how the Halperns describe what they got from Winship. They look forward to an active future, traveling, enjoying their children and grandchildren, and they say, spreading the word about how important Winship is.
We're the cheerleaders. We have now become the cheerleaders of Winship.
I know Howard and Lynne Halpern go out of their way to get people engaged with Winship. They're always challenging people. What can they do for Winship?
Winship stands for everything that is good in medicine, everything that is good in patient care, and everything that is good in cutting edge of technology.